This is True Echo, where real stories of courage, betrayal, and redemption rise from the shadows. In today's episode, one woman's act of compassion sets off a chain reaction that will shake the foundations of power. This is the story of Kayla Thompson, the intern nurse who lost everything for doing the right thing, and then changed everything. "You're fired, Kayla. Leave your coat and badge now." The words cracked like a whip through the sterile morning air of St. Bradford Hospital. A sea of white coats, receptionists, and even waiting patients froze mid-motion as Harold Whitmore's voice thundered from the lobby like a gavel. The CEO's stiff posture and slick gray hair added theatrical weight to his performance. But the performance wasn't for Kayla, it was for the crowd. Kayla Thompson, 22 years old, black, and barely through her residency, stood still. Not because she didn't want to move, but because she couldn't believe it. Her exhausted eyes, still carrying the shadows of an overnight shift, looked not at Whitmore but at the crowd. Some averted their eyes. Others whispered. And still nobody moved. "I'm sorry?" she asked, her voice barely above a whisper. Whitmore stepped forward, voice dripping with authority. "Gross violation of protocol. Unauthorized use of medical equipment. Treatment of an unidentified, uninsured subject. You broke every rule this institution is built on." From behind the front desk, Tiffany Blake smirked. The night receptionist, never known for empathy, tapped her acrylic nails on the counter in smug rhythm. She didn't even try to hide the glee on her face. Kayla's fists trembled at her side. Her jaw clenched. But she didn't speak. Not yet. She had seen what happened to others who had tried. The system didn't bend for truth, it shattered those who spoke it. She slowly reached up and unpinned her badge, K. Thompson, RN intern, and folded her white coat, placing both neatly on the counter like sacred relics of a dream she once believed in. The hospital that once applauded her as the top nursing student in the state now discarded her like waste. "I saved a life," she said quietly. "And you've destroyed your future," Whitmore snapped. "Security." The two guards, Paul and Jordan, stepped forward. Paul avoided eye contact. Jordan, the kinder of the two, looked pained. Still they followed orders. They always did. As Kayla was escorted past the rows of motionless colleagues, she looked back one last time. Nobody stopped her. Not the nurses she studied beside. Not Dr. Martinez, her mentor. Not even Naomi, who had helped her treat the patient. Everyone just watched, silent as statues. Outside, the cold wind slapped her face. Her thin hoodie provided little protection against the sharp morning chill. Her eyes drifted across the street where a homeless man used to sit. But he was gone. In his place, a man in a tailored suit, gold watch glinting in the sun, stood speaking into a phone. He looked straight at her for a moment, and Kayla felt a shiver that had nothing to do with the weather. She didn't know it yet, but that glance would change everything. Back in her crumbling Riverside apartment, she didn't cry. She didn't scream. She made coffee and stared blankly at the window. Her phone buzzed, 5 missed calls from a Manhattan number. The 6th call she picked up. "Miss Thompson?" The voice was sharp, polished. "This is Elijah Reynolds, senior partner at Reynolds and Rayner. We need to speak urgently about the man you saved last night." Kayla froze. "What man?" "Vincent Langston." The name hit her like a bolt of lightning. CEO of Langston Medical Group. Billionaire. Kingmaker. She blinked at the floor, stunned. "He's alive," Reynolds continued. "Because of you. And he wants to meet. Now." Kayla arrived at the cafe 48 minutes later, clutching her worn backpack, still in faded jeans and the same dark hoodie she wore when she was fired. She felt wildly out of place among the polished wood clinking china, an echo of sharp leather shoes tapping on marble floors. Every patron looked like they belonged. She didn't. Near the back, a man in a charcoal 3-piece suit stood up and waved. Black, mid-40s, calm intensity in his eyes. This was Elijah Reynolds, the senior partner. The voice on the phone. "Miss Thompson," he greeted her, not offering a handshake but gesturing to the chair. "Thank you for coming on such short notice." "I didn't really have anything else scheduled today," Kayla said dryly. Elijah gave a small, knowing smile and slid an iPad across the table. On the screen was a photograph. It showed a tall, sharply dressed man receiving an award from the president. His eyes, even through the screen, looked familiar. "Vincent Langston," she whispered. Reynolds nodded. "You saved his life. Without knowing who he was. Without asking for ID or insurance. That matters." Kayla stared at the screen, memory crashing into recognition. She remembered the man lying in a pool of blood on the ER floor, gasping, trembling. No wallet. No name. Just the word, help. I didn't know, she said. I didn't care who he was. I just knew he'd die if I didn't act. That's exactly why he wants to see you. Reynolds pulled a folder from his leather briefcase. Inside were documents, charts, statistics, internal memos. In the last 5 years, he said, over 89% of uninsured Black and Latino patients were turned away from St. Bradford, many of them in critical condition. 14 died. None of those deaths were reported properly. Kayla's stomach turned. She pushed the folder slightly away. Why are you showing me this? Because Vincent Langston isn't just a businessman. He's a reformer. Quietly. Strategically. And he now knows firsthand what happens when a human being is treated like a liability instead of a life. You proved something to him. Kayla leaned back in her chair, overwhelmed. I'm not a whistleblower. I'm not important. You are now, Reynolds said firmly. Whitmore didn't just fire you. He humiliated you. Publicly. On camera. He tapped the screen and pulled up a surveillance clip. Kayla being yelled at, her coat stripped away, her badge surrendered like a prisoner's ID. In the background, Tiffany Blake, smirking. That footage, along with audio files and testimonies, will be the backbone of a class action lawsuit, Reynolds said. But only if you're willing to stand at the center of it. Kayla's heart pounded. Why me? Because you acted when everyone else froze. Because Whitmore called you a disruptive element and tried to make an example out of you. And because, most importantly, this isn't just about him anymore. It's about a system that let it happen. Silence settled over the table. Then Reynolds leaned in. We want to name you as the lead witness. If you agree, we begin today. Kayla looked down at her hands. They were still marked from last night, scrapes, dried blood under the nails, trembling slightly. She thought of her mother, who had died of cancer, waiting for care no one would provide. She thought of the patients she'd seen turned away for lacking the right kind of insurance. I'm not doing this for revenge, she said quietly. I'm doing it so no one else ends up like my mom. Reynolds nodded. Then let's make them listen. At St. Bradford, meanwhile, Harold Whitmore paced his corner office like a general inspecting his fortress. He had just returned from an internal damage control meeting and was certain the worst was behind him. Kayla Thompson was gone. Her file marked for blacklisting. End of story. Or so he believed. He had no idea that Jordan Wells, the security guard who bowed his head in shame as Kayla was escorted out, was watching surveillance feeds from the previous week. Jordan had stumbled across a clip during a routine check. Whitmore in the admin break room, his voice low but recorded clear as day by the upgraded audio system. That little black girl needed a reason to get fired, Whitmore said. And she gave me the perfect one. Jordan froze. His finger hovered over the delete button. Instead, he hit export. He stared at the file for a long time before opening his personal email. He typed one line. I have something you'll want. I'm done being silent. He hit send. 3 hours later, in a glass-walled boardroom across town, Vincent Langston, still bruised, still bandaged, stood up from a leather chair and looked out at the skyline. We don't go to war quietly, he said. We expose everything. Behind him, his investigative team assembled. Lawyers, tech experts, former auditors, public health advocates. Start with every denial of service record from the last 5 years. Then get me the donor list tied to political campaigns. I want to know where every dollar went, and what it bought. He turned to Elijah Reynolds. And make sure Kayla Thompson is protected. She's not just our key. She's our spark. Reynolds smiled. She's ready? The next morning, Kayla stepped off the subway at 8:02 a.m., her nerves twisting like threads. She was headed not to St. Bradford Hospital, but to a nondescript building near the city's legal district, Langston Medical Group's Internal Affairs Office, where the quiet storm was already gathering. Elijah Reynolds met her at the entrance, phone in one hand, coffee in the other. Glad you came, he said. The team's ready. Vincent will join us shortly. Has he recovered? He refuses to rest. He says this isn't just about what happened to him. It's about what happens to people every day who aren't him. As they entered the conference room, Kayla's eyes widened. Digital projectors hummed to life. Laptops lined the long table. A wall-mounted monitor showed dozens of names, photos, patient charts, victims of St. Bradford's silent gatekeeping. Each denied care. Some alive, most not. God, Kayla muttered. A woman in her early 30s with sharp eyes and braided hair approached. You must be Kayla. I'm Dr. Keisha Loran, head of clinical data. I used to work for St. Bradford. You used to. Left when I discovered my charts were being altered to inflate efficiency rates. Code for fewer poor patients being seen. Vincent entered a few minutes later, still walking with a slight limp, his presence commanding the room. He greeted Kayla with warmth, not the stiff handshake of a CEO, but the genuine eye contact of a man who had seen death and owed his life to someone who had nothing to gain. "I don't know how to thank you," he said quietly. "You don't have to," she replied. "Just fix what they broke." Vincent nodded and gestured to the screen. "Let's begin." Over the next 3 hours, Kayla was taken through everything: copies of hospital memos redlining certain zip codes, emails from finance directors discussing strategic patient exclusions, a performance review of Tiffany Blake praising her ability to screen out cost-heavy cases. But then came the file that made Kayla's heart stop. It was an audio clip. Whitmore's voice, unmistakable. "She acts like this is a church. We're not here to save everyone. I've been waiting to get rid of that little black girl for months. She just handed me the rope." Kayla covered her mouth. Her eyes filled, not from sadness but rage. "Where did you get this?" she asked. "Security backup," Reynolds answered. "From someone who finally decided to do the right thing. Jordan." She remembered the way he couldn't meet her gaze that day. The shame in his face. And now he had done what no one else in that lobby did. He spoke. Vincent took a seat beside her. "Kayla, we're going public. A press conference is being scheduled. This won't be handled quietly behind the scenes. We're broadcasting it. All of it." Kayla hesitated. "They're going to come after me." "They already did," Reynolds said. "Now it's your turn." Back at St. Bradford, Whitmore prepared for a gala, the Healthcare Executive of the Year banquet at the Metropolitan Hotel. Tiffany Blake stood outside his office, her hair styled, her phone buzzing with congratulatory messages. "Heard anything about that intern?" she asked. Whitmore scoffed. "She's gone. Forgotten. Just another social media blip." Tiffany laughed. "You think she'll try to sue? She doesn't have the backing. People like her never do." But even as Whitmore raised his champagne glass to toast his discipline over emotion philosophy with the hospital board, across the city, Kayla was recording her witness statement under oath with federal attorneys present. Her words, clear, steady, heart-wrenching, became the cornerstone of a discrimination and corruption lawsuit now being quietly filed in multiple jurisdictions. That evening, Vincent's team published a secure link to the internal audio recordings. It was sent anonymously to key newsrooms, civil rights organizations and city council members. Then they waited. The next morning, it hit like a tidal wave. By 9 a.m., 5 major news outlets had already broken the story: St. Bradford caught in discrimination scandal, intern fired after saving life. The leaked audio clip went viral. Whitmore's words, "that little black girl," trended on every platform. Public outrage exploded. By noon, protesters began gathering outside St. Bradford with signs, "Healthcare is a right, we stand with Kayla," and "Patients over profit." Inside the hospital, tension boiled. Nurses murmured. Doctors questioned the silence of their leaders. And in the control room, Jordan Wells watched the live footage from the crowd. He exhaled. His quiet rebellion had become a revolution. Then his phone buzzed. "Jordan, this is Elijah. Meet us tonight. We have another recording. And it's time." Jordan looked around the camera room, heart racing. He finally answered, "I'm ready." The sun had barely set when Kayla arrived at the private meeting spot, a downtown office just off Lexington, where the lights stayed on deep into the night. Jordan Wells was already there, pacing nervously, a flash drive clutched tightly in his hand. When he saw Kayla enter, he froze. He started, but the words caught in his throat. She approached slowly, her voice gentle. "You don't have to say anything." "No," Jordan said. "I do." He placed the flash drive on the table, eyes flicking between Kayla and Reynolds. "I should have said something that day. When they walked you out. I should have stopped it." "You weren't the problem," Kayla said. "The problem was the people who made silence feel like the only option." Jordan nodded slowly, then exhaled and handed the drive to Reynolds. "It's all there," he said. Recordings from inside the finance meetings. Tiffany in the break room. Whitmore bragging about saving money by turning people away. Even audio of the head of legal saying uninsured patients are financial risks we can't afford. Reynolds slid the drive into a secure laptop. As the files loaded, Vincent Langston joined the room. The weight of everything hung heavy in the air. "There's more," Jordan added, reaching into a folder. "I found audit logs showing deleted patient records. All from poor zip codes. Mostly black and Latino. Reynolds looked at Vincent. We have enough now. No, Vincent replied. We need one more thing. He turned to Kayla. You. Kayla blinked. What? We need you to tell your story, on camera. Not in a press release. Not in writing. But to the world. The same world that watched you get fired and stayed silent. Now they need to watch you rise. For a long moment, Kayla said nothing. Her heart pounded. Her thoughts spun. Then she nodded. The video was simple. No background music. No high-tech visuals. Just Kayla in a plain navy blouse sitting in a chair speaking directly to the camera. My name is Kayla Thompson, she began. I was an intern at St. Bradford Hospital. And I was fired for saving a man's life. Her voice didn't tremble. It carried. It rose. He didn't have ID. He didn't have insurance. But he was dying. And I made a choice. I chose a life over a policy. The video intercut with actual surveillance footage. Kayla kneeling beside the bloodied man, Tiffany ignoring him, Whitmore shouting in the lobby. And now I know, she continued, that man was Vincent Langston, the CEO of Langston Medical Group. But that night I didn't know who he was. I didn't care. Because a heartbeat shouldn't need a $sign next to it. The final scene was the clip of Whitmore's voice. I've been waiting to fire that little black girl. Then Kayla returned to frame. People like me, black women from low-income communities, are told we should be grateful just to be in the room. That we should stay quiet. But I won't stay quiet anymore. She stared into the lens, her gaze unflinching. This isn't about revenge. This is about justice. Not just for me, but for the people they turned away. For the lives they let die. For the families who were told, there's nothing we can do, when there was. When there always was. The screen faded to black. Then a single phrase appeared. Every life matters. Without exception. Within 24 hours, the video exploded. It hit 1 million views in 10 hours. Major networks ran it on primetime. Celebrities reposted it. Civil rights leaders issued statements. Hashtags like #JusticeForKayla and #HealthcareWithoutHate top trends. More importantly, it opened a floodgate. Former nurses, interns, even patients came forward. I was turned away after a car accident because I couldn't pay up front, one woman said. My father died in the waiting room. They said there were no beds, said another. The outrage was no longer isolated, it was nationwide. Meanwhile, at St. Bradford Hospital, Whitmore's carefully curated empire began to shake. His office, once a monument to corporate order, had become a bunker of denial. What is this? He barked, slamming his tablet on the boardroom table as the video played for the third time. The room was dead silent. We have a press strategy, right? A rebuttal? His head of PR looked pale. Sir, we've tried. But, the footage, the audio, it's all real. And it's everywhere. Then issue a counter-statement. We'll sue for defamation. A junior executive spoke up. Sir, several board members have already resigned. Our primary donor froze all contributions. Whitmore's hands trembled. This is a smear campaign, he bellowed. It's a political hit job. But the room didn't echo him. It didn't nod. It simply watched. That night, Vincent Langston sat in his study reviewing the final evidence folder. Each document, each time-stamped clip, each racist comment caught on tape. Proof of a system designed not to care. Is the legal team ready? He asked. Reynolds nodded. And so is the media team. Vincent looked down at his hands. They still bore faint scars from the night Kayla saved him. I want the gala, he said. The Healthcare Executive Awards. You want to confront him there? Reynolds asked. Not confront, Vincent said. Expose. Reynolds didn't argue. He simply smiled. I'll arrange the broadcast. The grand ballroom of the Metropolitan Hotel shimmered with gold-accented opulence. Crystal chandeliers hung like waterfalls from the high ceilings. Velvet drapes framed massive screens, and servers floated through the crowd carrying trays of champagne. It was the annual Healthcare Executive of the Year Gala, and Harold Whitmore was the star of the night. He stood near the stage, wineglass in hand, his white tuxedo shirt immaculate, black bow tie perfectly straight. The mayor stood beside him, smiling for photos. Tiffany Blake hovered nearby, dressed in an elegant silver gown, her grin smug as ever. They think an intern can bring this empire down? Whitmore whispered to her, the corners of his mouth barely moving. Let them try, Tiffany said. No one cares about sob stories from the poor side of town. We write the rules. They just begged to follow them. Whitmore raised his glass and turned to the crowd, voice booming. To excellence in medicine. And to those of us who never let emotion cloud judgment. The applause rippled politely through the room. But backstage, in a quiet tech booth near the sound equipment, Elijah Reynolds sat beside a monitor, earpiece in place. Jordan Wells stood behind him, arms crossed, eyes sharp. And on another screen, Vincent Langston gave the cue. Now. The lights flickered. The screen on stage glitched. Then the room fell silent. Gone was the curated video of ribbon cuttings and award handshakes. In its place, grainy black and white surveillance footage. That little black girl. I've been waiting to fire her for months. She just gave me the perfect excuse. The voice was unmistakable. It was Whitmore. Crystal clear. Gasps cut through the ballroom like a blade. The mayor slowly lowered his wine glass. Phones began to rise. Whispers turned into murmurs. Tiffany Blake's smile vanished. On the screen more footage appeared. Tiffany laughing in the break room. Let her play hero for the poor. It's not like we're actually going to treat them. Then came the charts. Red highlighted rows. Denials. Dozens. Hundreds. Patients rejected based on zip code, race, and lack of insurance. Financial notes from the hospital's own system. Unprofitable patient. Reject admission. The screen flashed again. The Bradford Systemic Discrimination Files. Presented by Langston Medical Group. And then Vincent Langston's face appeared. Clean-shaven, suit-pressed, eyes unflinching. My name is Vincent Langston. On the 15th of last month, I was denied emergency care at St. Bradford Hospital. I had no ID, no wallet, and no insurance card. I was bleeding on the floor. And they let me die. Or they would have, if not for Kayla Thompson. At the back of the ballroom, the double doors opened. Kayla walked in. Dressed in a deep navy suit, her hair pulled back, face glowing in the warm chandelier light. She didn't smile. She didn't need to. Every eye turned. Cameras swiveled. Gasps rose. Beside her, Vincent Langston entered, followed by Elijah Reynolds. And behind them, former St. Bradford nurses, patients who'd been turned away, Dr. Luis Martinez in his white coat, and Jordan Wells wearing his new security director badge. They stepped onto the stage silently. The screen showed images now of those who had been denied. A pregnant woman who miscarried in a waiting room. A young man who died after being refused for not having documentation. An elderly patient turned away despite being in cardiac arrest. The final image was Kayla, on her knees, performing chest compressions on a nameless man bathed in blood. The room was silent. Then, without warning, federal agents entered from the side of the ballroom. Their suits were crisp. Their badges visible. One approached Whitmore, who had gone ghostly pale. You are under arrest for medical discrimination, fraud, and obstruction of a federal investigation, said Agent Clark, his voice low but firm. Whitmore staggered back. You can't do this here. Not here. He looked at Kayla, his face twisted in panic and rage. You're nothing. You were supposed to be gone. You don't belong here. Kayla stepped forward. Her voice calm. Still. You're right. I don't belong in your system. Because I'm building one that doesn't need to reject the sick to stay alive. Applause broke out, first hesitant, then thunderous. As Whitmore was handcuffed and led away, Tiffany tried to slip toward the exit. But another agent intercepted her, handing her a subpoena and freezing her in place. You're not going anywhere, Miss Blake. Cameras snapped. News anchors rushed to live coverage. The gala had become a reckoning. Then, as the crowd fell quiet again, Vincent returned to the mic. I have just signed the transfer papers, he said. Langston Medical Group has acquired full operational control of St. Bradford Hospital. Effective immediately, the facility will be renamed. He looked at Kayla, his voice swelling with emotion. The Kayla Thompson Health Center. There were no fireworks. No music. Just silence and then applause. The kind that comes not from celebration but from recognition. Of truth. Of justice. Of something real. The next morning, the sun rose over the city, casting a soft glow on a sight no one could have imagined just a week earlier. The old gold letters reading St. Bradford Hospital had been removed. In their place, freshly mounted in bold, brushed steel. Kayla Thompson Health Center. Every life matters, without exception. Outside the newly renamed facility, a long line had already formed. Elderly residents from the Riverside neighborhood, young mothers clutching infants, day laborers in dusty work boots, all stood waiting, not in protest but in hope. At the front doors stood Maria Gonzalez, a nurse once fired for being incompatible with the hospital's image. Now reinstated, she wore a clean white uniform and greeted every visitor with warmth. When a Haitian grandmother shakily held out a tattered Medicaid card, Maria gently pushed it back. "Hold on to it," she said. "Here we ask where it hurts first. Paperwork comes later." Inside, the transformation was underway. The triage area had been reorganized by Dr. Luis Martinez, now officially named Director of Emergency Services. Under his new protocol, no patient would be asked about insurance before being treated. All emergency cases were seen immediately. Kayla stood beside him as he gave his morning briefing to the new staff. She wasn't wearing a suit. She wasn't sitting in a corner office. She wore a navy blue scrub top, her hair in a loose bun, a stethoscope looped around her neck. "Not for show, for work. I'm not here to manage," she told the new interns. "I'm here to serve." One of the nurses, a black woman in her early 20s, raised her hand. "Is it true they offered you the position of hospital CEO?" Kayla nodded. "I turned it down. Titles don't heal people. Action does." She spent that day doing intake rounds, speaking with patients, reviewing care plans, and personally mentoring the new class of nursing interns, most of whom came from low-income neighborhoods and communities that had been denied a chance to serve. That night, Kayla returned to her apartment, still the same one by the river. Still modest, still surrounded by crumbling fences and creaky floorboards. Her phone buzzed. It was a video call from Vincent Langston. "Hey," he said, smiling. "You might want to check the front page." Kayla clicked the link he sent. New York Times headline. "From fire to founder, the intern who brought down a healthcare giant." "I don't want to be famous," Kayla said. "You're not," Vincent replied. "You're something more dangerous than that. You're a symbol." She sighed. "And what happens when symbols fade?" "They don't," Vincent said. "Not if they're backed by real change." Then he leaned in slightly. Langston Medical is expanding the Kayla Thompson Health Center model to 5 more cities. Chicago, Detroit, Houston, Cleveland, New Orleans. Kayla stared, stunned. "We want you to help lead the pilot. Not from behind a desk. From the front lines." She didn't answer right away. "I'll think about it," she said finally. "But first, I have rounds at 6 a.m. Across the city, not everyone was sleeping peacefully. In a federal holding facility, Harold Whitmore sat in a gray jumpsuit at a concrete table. His hands trembled as he read the letter from his attorney. Indictments formalized. 15 years minimum. No bail. He threw the paper aside. Moments later, he was escorted to the visitation room. On the other side of the glass, Jordan Wells. "What do you want?" Whitmore spat. Jordan slid an envelope through the visitor slot. Whitmore opened it and froze. It was an invitation to the official renaming ceremony of the hospital, now the Kayla Thompson Health Center. Inside, a large photo showed Kayla standing beside Vincent, surrounded by former patients and staff. Below it, a quote in bold lettering. "Don't take revenge with anger. Build something so great evil has no place to exist." Whitmore's mouth twitched. "You came to gloat." Jordan shook his head. "No. I came because Kayla told me to. She said even people like you deserve to see what real leadership looks like." Whitmore stared at the photo, hands shaking. "She's not qualified. She's not even." Jordan leaned forward. "She didn't need a title to save your life. And now she's saving thousands." As Jordan left, Whitmore sat alone, the photo still in his hands. And for the first time since his arrest, the arrogant gleam in his eye began to dull, not from defeat but from shame. Back at the health center, Kayla walked through the halls in the quiet evening. The rooms were full of life. Children being treated. Elderly patients being comforted. Nurses smiling not from obligation but because they were proud. She stopped at the reception desk, where Maria had pinned a small laminated card next to her monitor. Read, "Do not ask for insurance before asking where it hurts." Kayla smiled. Then she picked up a clipboard and headed back into the ER. There was still work to do. 6 months later, Kayla Thompson stood at the podium in the Grand Hall of the National Medical Ethics Conference in Washington, D.C. The stage was minimalist. No banners, no golden laurels, just 3 words projected behind her in tall, clean font. Compassion. Courage. Change. She wore an elegant white blazer with subtle silver stitching. A heart-shaped pin sat on her collar. Inside it, a small stethoscope looped through the symbol of justice. She had no script, no teleprompter, and no need for one. Across the hall sat thousands, top medical professionals, policymakers, medical students, and most notably, dozens of patients from underserved communities who had been invited as honored guests. Some had once been turned away at St. Bradford. Now they were witnesses. Kayla looked around the room, took a breath, and began. I used to think getting fired was the end. I thought that when they stripped my badge, when they dragged me out of that hospital, I had lost everything. She paused, her gaze unwavering. But I was wrong. That wasn't the end. It was the beginning of a story I never expected to write. The room was silent. I was fired not because I broke the law, but because I broke a culture. A culture that told us to put profits before people, rules before lives, and silence before conscience. And when I chose to save a life instead of ask for a card, I became the problem. She looked directly into the crowd. But the truth is, when you're called a problem by a broken system, you may just be the solution. A ripple of applause started but quieted as Kayla raised a hand gently. This is bigger than me. This is about the people who died waiting to be seen. It's about the black, brown, immigrant, and uninsured lives that were ignored, filtered, deleted from records like they were statistics, not human beings. She then stepped aside from the podium, motioning toward the screen behind her. A photo appeared, Kayla mid-compression, blood on her arms, saving Vincent Langston in the ER. The caption read, "She didn't ask who he was. She just saved him." Then the screen showed the current stats of the Kayla Thompson Health Network. 5 cities. 7 nonprofit centers. Over 53,000 patients treated regardless of insurance. 0 denials. The audience erupted into applause. This time, Kayla didn't stop them. When it settled, she returned to the mic for one final message. I don't need to wear a white coat to know who I am. I don't need a title. All I need is a reason. And if that reason is to make sure no one is ever told, we can't treat you because you don't have enough, then that's what I'll spend the rest of my life doing. She stepped away. Vincent Langston rose and joined her, placing a hand on her shoulder. The applause thundered again, not just for her, but for what she represented. In the weeks that followed, the hashtag Model Kayla initiative spread worldwide. Medical schools in over 30 countries added her story to their ethics curriculum. A statue was unveiled at Stanford University titled, "The Hand That Saved Without Asking." At Riverside Community College, where Kayla had once struggled to get accepted, she began her first class as a guest instructor. The room was filled with students from neighborhoods like hers. One Somali girl in the front row whispered, "She's like us." That same week, a nurse in a small clinic in Colombia taped a handwritten note above her desk. Every hand can heal. Kayla Thompson. In rural Kenya, a mobile clinic renamed itself the KT Outreach Unit. The slogan painted on the side read, "We treat the person, not the paperwork." Kayla turned down multiple lucrative speaking tours. Instead, she spent her days mentoring interns, reviewing patient policies, and traveling to each of the new health centers. In every city she visited, she carried a framed photo of her mother and hung it in the lobby. One evening, she walked into the newly opened Kayla Thompson Health Center, Oakland Division. As she greeted patients, a boy about 7 years old tugged at her sleeve. "Are you the lady who made this place?" Kayla knelt down and smiled. "I helped. But a lot of people made it happen." "Are you a doctor?" "I'm still learning," she said. "Always." The boy grinned and ran back to his mother. Maria Gonzalez, now Director of Human Resources for the entire network, walked up and handed Kayla a tablet. "Washington wants you back for a speech." Kayla looked out the glass door as the sun dipped over the Oakland skyline. "Maybe," she said. "But not today. Today I want to check on room 3. I heard someone just came in without insurance, and a sprained wrist." Maria smirked. "They're already being seen." Kayla walked down the hallway, clipboard in hand. In a stark contrast, in a federal prison 300 miles away, Harold Whitmore sat alone in the prison library, sorting worn-out books with yellowed pages. No headlines. No suits. No applause. On his cot was a torn photo, a copy of the health center dedication mailed anonymously. In the image, Kayla stood smiling among her team. On the back of the photo someone had written, "Your empire fell. Hers rose. That's justice." Whitmore tore the photo in half. But he couldn't tear the truth from history. The story of Kayla Thompson became a movement. A revolution started not by politics or power, but by one choice made in a quiet hospital hallway. She didn't destroy the system with fire. She made it irrelevant. Not with revenge but with reinvention. And in the echo of every footstep in the halls of her health centers, her legacy continues. Save first. Ask later. Build something so good that cruelty no longer fits. If you've ever been punished for doing the right thing, if you've ever been told to stay silent when your heart screamed for justice, This story is your reminder. You don't need permission to change the world. All it takes is one brave act of compassion, done when no one else dares. Kayla Thompson didn't ask for glory. She just refused to accept a system that forgot how to care. And in doing so, she made history. Subscribe to True Echo for more real stories of justice, courage, and second chances. Leave a comment. What would you do if you had to choose between the rules and what's right? And don't forget to share this story with someone who needs to remember, doing the right thing is always worth it.